Hello, everybody, and welcome to the show. Very happy today to bring you Omar Fuentes. And I love nothing more than saying a name like Fuentes, right? I don't know if I'm saying it well or I'm insulting your entire culture, but I
No,
love
it's
the
great.
la- I love anything that sounds like a song, and that's what your last name sounds like to me.
That's awesome. I'm going to tell my wife that. So I'm going to say, whenever she gets mad at me and she says my full name, I'm going to say, all you're doing is singing.
Omar Fuentes. It's
That's
beautiful.
awesome.
Well, Omar is the CEO of accelEQ, which is a virtual healthcare platform.
Yes.
And since we are discussing the business of medicine, I don't know a better way than to talk to a veteran, somebody that has served our country, Marine, also
Yep.
chairman of the Florida Association of Veteran Owned Businesses.
Yep.
I'm all about veterans, so thank you for all that you do and
Thank
have
you.
done and will continue to do. I'm excited to hear more about you and your platform. So, Omar, why don't you
Yeah,
tell the audience a little bit about you and your why to start this company?
absolutely. So again, Sharon, thanks so much for having me on. I'm excited. I've seen the other ones, and we have a mutual friend that we were just discussing prior to recording, and it's been
Shout out to
wonderful to.
Sarah Connolly.
Yes, yes. So Sarah's been wonderful in my corner and in yours. So I'm glad that we're able to connect here and now have this conversation. So thank you for the opportunity. But yes, I love the way you actually say my name as well. Omar Fuentes, CEO of accelEQ. Like you said, I was a Marine Corps veteran, did security forces, kicked down doors and kind of raided rooms and things like that, and never thought that I'd actually get into the space of healthcare medicine and now health technology. So I'm really excited. Like you mentioned before, also chairman of the Tampa chapter of the Florida Association of Veteran Businesses, or FAVOB for short, because that's a pretty long name.
Mhm.
But the whole goal for me when I got out of the military was to truly make a difference. And it really kicked things off for me because when I was in boot camp many years ago, my father actually had a triple bypass while I was in boot camp. They did not tell me at all because that was actually one of the triggers that would allowed me to go home and get out. And most times recruits don't come back.
Mhm.
Um, and they actually purposely hid that from me. And I saw my father when I graduated because he wanted me to complete boot camp. I saw my father, my family ran to me, and I saw my father walk over to me. He was very slow. Now, my father played soccer. He was a healthy guy. He taught me how to play soccer, right? Coached me. And so when I saw him fragile over to me, I knew something was wrong. And that really kind of opened my eyes up to the healthcare space. So after I got out of active duty, and saw my father going through quite a bit of issues with his health, I just knew I wanted to continue down in that space. I took a little bit more of a different path and worked for the large healthcare companies. And after 18 years with them, I decided to go out on my own, help employers to have accessibility to healthcare that's much more affordable. But then
Mhm.
even in that, I realized in doing our analysis and taking a look at really just the history of things, that there was a lot of pressure on the medical professionals,
Yeah.
and that it really starts with them and that patient provider interaction and life cycle. So once the pandemic hit and we saw that it was much more necessary to support the medical professionals, I thought let's go all in, and we started to develop our virtual care platform. So that's a lot that I've regurgitated and kind of me in
Good.
a nutshell.
I like it. So you, to overuse the word like everybody else, decided to pivot.
Yeah. That's actually a great point. And what I'll say about that is, so when we were evaluating exactly what we should be doing now and the shift that we should make,
Mhm.
um, I realized that a lot of people utilize that right there was a pivot. But what I really in internal reflection or kind of, emotional intelligence and things like that, right? I felt like the pandemic squeezed out of us what was already in us. And
Yeah.
from my business and for me, it was innovation. And innovation is not creating something new, but it's actually enhancing something that's already in existence, or maybe inserting something new into what's already being. So I really felt like we were doing that. So we went from consulting employers to now, while we still do that, our focus now has shifted to providing a virtual care platform that allows patients and providers to communicate much more efficiently, right? Through components like telemedicine, messaging, right? Documentation sharing, things like that, so that we can deal with the less complex issues virtually and leave room for the more complex issues in office for the providers, so that we can keep everybody healthy and safe. And then also really kind of depressurize the process that medical professionals are experiencing today.
So great. So why don't you just walk us through a little bit what that looks like? I'm Dr. Johnny Moe, and
Mhm.
I'm interested in acquiring your services, Mr.
Yeah.
Fuentes. So what does that look like? I want to visualize, and I want to paint that picture for the audience that's listening. How
Yeah.
is
So
it different? I mean, that too, right? I mean, innovation. We don't have to recreate the wheel. We just have to make the wheel better. That's
yep.
how I've always felt, that that wheel has been created a long time ago, but
Yes.
we do have more efficient ways of doing things today, thank goodness, through technology. So let's hear about how it goes from kind of A to F.
Yeah, absolutely. So the way it would work is that you would hire a company to essentially be on the back end of your site or technological platforms that as a medical professional or physician you're already utilizing. And we're going to be inserting a few other things that will make life for you much easier, right? While increasing your RVUs or revenues per patient without increasing the cost directly to your patient. So the way it would work is you would be set up on our platform. We would be able to digest all of your patients into our platform, integrate with your EHR, EMR, right? And any other little nuances that we know that providers like to utilize, right? Including calendars and such. But what would end up happening then is that we would leverage a regular phone number as well as web chat initially. So the way that the first interaction would be is announcing to all your patients that you have this new virtual care platform that you can interact with them on. That's going to be increased response times, right? And be able to address our daily healthcare needs much more efficiently. So let's say I'm your patient, and I wake up in the morning and I have a sore throat, headache, stuffy nose, low grade fever. But in my medical records, it shows that I suffer a lot from allergies, right? So today the pollen is high, right? So I wake up and I'm sitting here saying that I have a big presentation, on Monday. I've got to feel okay. I've got to press forward. I pick up my phone and I actually text message the provider's office and I give them my symptoms. So I give your office, Dr. Mo, my
Excuse me, Dr. Johnny Mo. Thank you.
Johnny Mo, sorry, Dr. Johnny Mo, right? So Dr. John, I'm just going to say Dr. Johnny because I actually like calling them doc by their first name, right? So Dr. Johnny, I message you, I'm giving you all my symptoms. Your office receives it. And what we want to do is we want to show them that they can leverage their advanced practice providers, right? Practitioners, APs, and, PAs and nurse practitioners, right?
For the non-medically inclined.
I know, I gotta stop that, right?
So we're talking about advanced practitioners. We dare
Yes.
never call them mid-level because they are so far from mid that
Right.
they are advanced. So
Right.
an advanced our nurse practitioner or a physician assistant, which is a lot of people don't even know what that is, Omar, right?
I
So
mean,
that is it's like doctor, and then they're right below and working together, and they're able to write prescriptions,
yep.
and really treat the patient
hmm
360.
Yeah. So they're able to, they're acting just like the doctor, right? I mean, they're their eyes and ears as well. And what ends up happening is essentially the MD oversees them, right? So we want to leverage that component, right? Or their skill set and have them work at the higher end of their education, right? And training. So now what ends up happening is you receive that message, you ask some clarifying questions. So let's say that it's that nurse practitioner, ask some clarifying questions, and they identify that in your medical records that you have allergies. They see that the pollen level is high, and then they basically say, hey, listen, Omar, you're really having it's just your allergies acting up today. There's no reason to come in. So what I'm going to do is I'm going to send some prescriptions that alleviate some of the issues that you're dealing with right now. And it looks like you're actually out of your allergy medication as well. Let me send that to your pharmacy. If you have any questions or things get more complex, feel free to reach back out to us. Now the interaction is done. And the great news is that through our platform, how that benefits the provider or that provider's office is that we automatically document that interaction. So those messages going back and forth are automatically saved into the patient case file. So instead of a nurse practitioner or a MD, I'm sorry?
It's okay. I just want to make clear that so everything in the chat goes right into their electronic health record.
Correct. Yeah.
Okay.
So it automatically, because one of the issues that we're seeing is that these medical professionals and particularly even primary care physicians are spending 20 minutes plus on documentation per interaction, right? And if they're seeing 20, 30, 40 patients a day, I mean, you're talking about hours upon hours of additional time, right? And we want to lower that time from instead of 20 to 5 minutes or less. So all they're doing is cleaning things up.
So you start, of course I get excited when I hear text messaging.
Mm-hmm.
I'm like, wow, that seems so easy and wonderful.
Right.
Does that text messaging always turn into a telehealth visit, or can it remain a texting platform and then them able to prescribe something for the patient?
Yeah. So what ends up happening is it goes immediately. So that's a great question, first off. So what ends up happening is that one is you can, as a provider, you can actually bill for telemedicine visit through messaging, right? So there are actually specific codes from CMS that allow for that. Now it has to be an existing patient, but it can be done. But you can also leverage it. So it can be both. You can also leverage messaging just so that you can ask some clarifying questions. So what ends up happening is once you message, depending on the question, it'll go into a general queue, and then someone in the office will be able to then put it into the appropriate queue to say, this is an administrative question or this is a medical question, right? And then now the appropriate people are able to address that question or begin that particular interaction for a treatment.
So let's break this down for everybody so they can really understand how this innovative technology can improve time management within an office. So what happens without your system? Mm-hmm. A patient calls in, they get the front desk person, or no, they don't. Wait. They get the automated attendant, right? Yeah. They press 1 for English, 2 for Spanish, Fuentes, who knows where you're going with that one. Right. And then
that's true.
And then it's like schedule a new appointment. If you're a doctor's office, you listen to all of that. And then, for triage. So that would mean you want to talk to a nurse, you want to talk to, it's probably a medical assistant, it's probably not a nurse, just so you know, not there's anything wrong with that, but you're not talking to a nurse, a registered nurse most of the time in a private practice. And then it goes to the human being, they answer the phone, they take down all of your information, now they stop. And now they go and they talk to the physician.
Right.
Okay, and then the physician gives them the information. Now the triage nurse either takes them back from that hold that they put them on, which more than likely they are not doing that. They have to call them back because the doctor's in a visit with another patient. And then they call them back and they let them know, this is what you're going to have to do, or you're going to have to come into the office. Mm-hmm. So there's so many inefficiencies in the way things are done today, which can be so frustrating for a patient that wants something as simple as a renewal of their allergy medicine, right?
Right.
And when you have gone through a pandemic, such as the one we're in right now, you would hope that that technology and that practice is advancing to the time that we're living in.
Right. And just to actually expand on it, our platform doesn't stop there. So let's say we thought it was allergies. The next day, you have now a high grade fever, your body's aching, you're in sweats and all these different things. We're in a pandemic. So you reach out and you're like, hey, look, I need to go to the ER, or, which is another point, right? Is that a lot of, issues that are dealt with the emergency room really aren't urgent issues and that your primary care can handle immediately. But so what ends up happening is you message back out to them, you give them the symptoms. Again, they ask them clarifying question. They say, hey, listen, it actually sounds like you may actually have COVID-19. I'm going to, here, and through the application, whether it's web chat or text, you will automatically get a schedule and say, can you come in at 9:30, 10, or 3 o'clock today? Select one, boom, you got one. They'll immediately send you instructions on what to do once you get here. Drive in the car, keep your mask on, messages is here, we'll come out, we'll swab you, and then you're on your way, so to speak, right? So now what we're doing is we're escalating the issues, and what we're doing is we're mimicking like essentially IT help desk. So when you first have an issue, you don't go immediately to the guy that has all the certifications, been doing it for 20 years. You've actually going to someone who can handle kind of less complex issues, right? And then it escalates accordingly. So if now you have an infection somewhere, whatever case may be, they're saying you got to actually physically come in now. Let's schedule that appointment, right? We can do that. And all those different interactions are what's automatically saved into the patient case file. And then afterwards, it's the automated follow-up as well. You know what I mean? Here's the treatment plan. Here's, we got to schedule another appointment. So we're trying to get into a place where we're creating a tremendous amount of efficiency for the provider, but also greater accessibility to the patient.
Omar, we're finally going to get rid of the humans.
Well, what's funny is that I haven't even gotten into the fact is that we're adding decision tree and artificial intelligence to our platform. But again, the component is not to eliminate the provider, right? Which I get, right? You see some movies and stuff where all of a sudden the AI actually seems to actually even be able to build up emotion, right? So that they can have the appropriate response given the certain circumstance. So
Omar, I watched a robot deliver food into a hotel room because of an NHL hockey team, they can't go out and meet the Uber Eats delivery driver. So the NHL paid for a robot, and the robot came, and I watched it through the people.
Get out.
Yeah, and it opened it up. It took it out because he doesn't have to have any human interaction, no chance of transmitting any virus that might be floating around in the world right now. Yeah. And that's where we're going. So I want to make a point by saying that if you are not, if whoever's listening or watching today, if you're a physician or if you're a patient, you need to start, thinking about the future that is happening now, not 10 years from now. So when the pandemic started and I started really encouraging my physician clients to get just go telehealth, and then don't go back, because once the humans get used to the efficiency of technology and saving on gas and saving on driving and saving on sitting in the waiting room with miserable Mary that really hates you for being there. Sorry, Mary, but we know you're out there. Yeah. And we don't want to talk to you anymore, okay? We don't want to replace all the humans. I mean, I am kidding about it.
I know what you're saying.
There'll always be a need for us to be able to let the robot in the door. But I really think that the efficiency is so warranted now. Nobody's going back. But I hope to God nobody goes back to the way it was before.
I don't think it's going to happen. I think the cat's out of the bag already. I mean, even CMS has continued to extend these lack of restrictions, so to speak, these HIPAA restrictions for the platforms, right? I mean, I was literally talking to a pain management doctor, and his PA was there, or a physician assistant was there, and he's like, listen, as a pain manager, he's a specialist. So for me, I always see the patient, right? And that's exactly kind of how, they comprehend everything. I'm dealing with the much more complex stuff. Everybody else in the office is doing the follow-up and the preventative and all that good stuff, right? So when I was talking to her, she's like, yeah, we still literally utilize Facebook Messenger to video chat with people. And it's just amazing to me. And it's astonishing that we haven't really, the innovation part for us is that we're putting everything that's already in existence together, incorporating or building them as modules, and then incorporating what the provider actually wants to continue to utilize, right? and then inserting things that they're not doing right now, like the messaging, like the transcribing of teleconferences or video chats. The great news is our platform allows for up to 3 people on a video chat. So that means you have the primary care, the patient, the specialist, primary care, patient, caregiver, family member, whoever that third person needs to be, right? PT, the physical therapist, right? We're allowing for and guess what? Both providers will now be able to actually bill for that same interaction instead. Now, what does that do for the patient? These appointments were already going to happen, right? So they're going to the provider, then they're saying, you got to go talk to this person, all right, and so on and so forth. So when it's appropriate and warranted to coordinate that care, they can do that. And all it's doing is just saving time and money, and really improving the quality of life of everyone involved, to include the provider, the medical professional.
Yes. I love that this merges with the scheduling,
Mm-hmm.
because that really takes a toll, just to find out where somebody's available in a slot. I mean, from somebody who's managed practices before, I mean, I really understand the minutia that goes on that need not be there anymore. I
Mm-hmm.
mean, it's scary to think that today that there's still even physician practices that don't have websites that are optimized for mobile.
Yes.
Right.
Yes.
Them too, huh? You have to accept what's happening today,
Right.
with technology and with this innovation. It's great, and it's going to make everybody's life so much easier. My question to you next is, does your software merge with all electronic health records?
So the great news is that we'll go ahead and create an API to connect to them. The more complex, then that means we have to kind of evaluate how we can actually do that a little bit more. There is actually a company out there that we'll work with that essentially it's a group of Epic guys. So Epic is another electronic medical record or health record for providers. It's so complex that they started their own company to be able to now integrate with third-party applications, which we would be that third-party application into there. So we will definitely do that. The more complex is of course we'll determine the cost of implementation and things like that. But yes, our whole goal is to create, I guess, to be the connection point of everything that they want to do, and make their life much more efficient.
Omar, what has 2020 taught you? Every single person does the same thing when I ask them. They take
Well, it's because a lot comes to my mind. So what 2020 has taught me, to be quite honest, is that that it's tough times don't last, but tough people do. I guess that's just the way that I can kind of put it. I mean, 2020 by far was tough for everybody. Some tougher than others, depending on circumstances and things like that, right? It also forced me to be much more emotionally intelligent, so that I can understand what other people are going through and how that impacts them. So
I love that answer. That's great. So, Omar, in the show notes, we have all of your information where people can find out more about you, your website. If I could give a small plug for just the veteran community in general.
Oh, yes.
I do a lot of recruiting myself, and I refer out to a lot of businesses that are veteran owned. I work very closely, obviously, with HCC. I just signed up for some mentorship. They always got me doing something crazy over there. But whatever
Yes.
to do, I always say yes. I think it's so important that we give back. But if you really want to work with people that are loyal and committed and sensitive and empathetic, then you hire a veteran, or you bring on a veteran to work with. So I appreciate all that you are doing, and especially because it's within this medical world that I live in and have for many, many years. It's always nice to see people wanting to help physicians make their lives more efficient so they could eventually get home to their families.
Yes, absolutely. Well, thank you so much. And again, I had a blast.
Yeah, it was really great. And we love Sarah Connolly. We're both going to give you a shout out right here on the show.
Sarah, you're the woman.
Right? If you ever need a great healthcare attorney, that is your woman.
She is 100% the one.
Omar Fuentes.
Yes, Sharon, I love it.
You can't even say my last name, and there is nothing that is musical about it, so don't even try.
I'm not going to.
Yeah, good. Thank you so much for joining.
Thank you so much, Sharon. I appreciate it.
So don't forget, if you mention that you have seen the show or listened to the podcast, Thai Technology, 3 months for free.